Infectious Diseases. He serves as their director. Dr. Fauci, 30 years since we've had the first reported cases of AIDS. Where are we today?
Well, we've made an extraordinary amount of progress, but if you look at the profile of the epidemic, it really historically has been devastating. If you look back now over 30 years, there have been about just short of 70 million people infected, about 30 million people have died. There are 34 million living with HIV throughout the world, and there's about 2.6 or 2.8 million new infections each year. So it's still really a very important public health, global health problem. The good news about it is that there have been spectacular advances, particularly in the arena of therapy. When I was taking care of HIV patients in the very early 80s, when the cases first became manifest, if someone came into our hospital, they had a median survival literally measured in months, 6 to 8 months. If somebody comes into the clinic now with newly acquired infection and you put them on appropriate therapy, you could predict that they would live an additional 50 years. So that's the good news about it. The problem is, in many parts of the world, it's still out of control. 2.6 million new infections each year is completely unacceptable.
Is that, that's worldwide, not just
worldwide? Predict that they would live an additional 50 years. So that's the good news about it. The problem is, in many parts of the world, it's still out of control. 2.6 million new infections each year is completely unacceptable.
Is that, that's worldwide, not just
worldwide? No, the United States, we have about 56,000 new cases each year. There are about 1.1 million people in the United States infected with HIV. One of the real issues is that about 20% of them do not know that they are infected, and those are the ones who disproportionately are infecting other people. They don't even realize that they're infected. That's one of the reasons why currently one of the real pushes is to be very aggressive in seeking out and voluntarily testing people and getting them under care and therapy.
Why are not more people getting tested?
Well,